Hi everyone, I'm Renee Hammonds and I'm going to discuss prevention of getting the cold and flu this season. So I'm at the store, but I'm really sick and I have a cough and I have a fever and I'm sneezing and I'm coughing in my hands and I don't wash them and I don't use sanitizer and I go throughout the store touching the cart, touching products on the shelves. I touch the keypad and now you're in line behind me and I'm coughing and you don't think about it and you touch the same things I do, and then you go and later touch your face and touch your nose. So after listening to my discussion, I'm hoping that you can get an idea of what the cold and flu virus is and how to prevent getting it. According to the CDC, which was last updated February 8, 2012, both viruses, the flu and the cold virus, affect your respiratory system. The cold virus, you have like coughing and sneezing, runny nose, stuffy nose, whereas the flu virus, you can have also fever, severe fatigue, weakness, which can also lead to bacterial infections and pneumonia and may even require hospitalizations. Reported on the Medline Plus site, which is part of the National Institute of Health, last updated July 10, 2013, that you can get a cold from touching objects that have the cold virus on it. Now, the CDC reports that the flu virus can spread 6 feet away from coughing or sneezing. Now, when I did that survey of all of you in the class, 62% reported getting the cold or flu virus sometimes. And another 62% also reported not having insurance and not getting the flu vaccine. So we're going to discuss cold and flu preventions, and according to Medline Plus, hand washing is the most effective way to prevent getting the cold. So if you hand wash for at least 20 seconds briskly, that can reduce your chances of keeping the cold virus on your hands and then later spreading it to yourself. Another way is to avoid sick people is another good prevention. If you know someone is sick, then stay away from them. So if you don't have water that you can wash your hands with, then they also recommend that you could use hand sanitizers in replacement of washing your hands with soap and water. Now, on the survey results, it was kind of variable where some of you did use hand sanitizer but not on a daily basis, or you washed your hands but not very frequently. So one should consider improving your hand washing, using hand sanitizer when out in public when water and soap is not available, and getting the flu vaccine. An article from Medline Plus on August 2012 reports that 2 weeks after getting the flu vaccine that you're protected. So during this flu and cold season, you want to take any prevention methods that you can to help prevent yourself from getting sick. Now, we all have families and we're busy with school and work and also spending time with our family. And getting sick can cause us to reduce that time, can be costly. We could have missed time at work and not be able to apply ourselves to the things that we need to do because we're sick. And additionally, those getting sick with the cold or flu could require hospitalization potentially if you get a bacterial infection, or it could cost you medications to help treat the symptoms from the cold and flu virus. So when you're out in public, pay attention to the people that are around you and see if they're coughing in their hands and sneezing and not covering their face. Pay attention and see if they're using hand sanitizer, or are they just going around and touching objects with dirty hands that have germs on them. I can't afford to get sick. I have a lot of things to do. And so pay attention to your environment around you and who is sick. Try to avoid them. Wash your hands frequently. Use hand sanitizer when available. And consider getting the flu vaccine. All right. Be healthy. Thank you.